here. And just going to quickly allow everyone that I see on the call so far to introduce themselves if they have the ability to do so with their audio. So I think I see Kim Herzing from Marana Healthcare. Hi, Kim. I'm not sure if you have audio this morning or not.
Hi, can you hear me?
Yeah, I can hear you.
Oh, perfect.
Awesome.
Hi, everybody. How you doing?
Hi, good. Did you want to go ahead and introduce yourself, kind of share what your role is, give people some context?
Sure. My name is Kim Herzing. I'm the transportation coordinator at Marana Healthcare. Just make sure all the vehicles are functioning properly and through the ADOT program, and just, learning new things every day.
Okay, great. Thank you so much for being here. I appreciate it. I think I see Donna. So Donna Gillette, you want to go ahead and introduce yourself?
Good morning, Janine. Good morning, everyone. I'm Donna Gillette. I'm with Easter Seals Blake Foundation. And I've been working with the transportation for both the CEQA and the PAG region for a number of years.
Hi, Donna. Thank you. And then I think I see Mary O'Donoghue from PCOA. Hi, Mary. Good morning.
Good morning, everyone. I'm Mary O'Donoghue. I am the Volunteer Services Coordinator with PCOA, and I also, most and probably a big piece of what I do is facilitate our Neighbor Cares Alliance program, working with groups that are out there providing transportation to adults, older adults that are aging in place in the community.
Great. Thank you so much. Welcome. I think I see Chris Blue as well from the city of Tucson. Hi, Chris. Good morning.
Hi, good morning, everyone. My name is Chris Blue. I'm a transit services coordinator at the city, and I help put together the grant applications and list of projects that we submitted this last grant cycle. My main role at the city is with compliance and contract management, but I try to get involved in mobility management whenever possible. So happy to be here joining you all.
Thank you, Chris. Appreciate you. Hi, good morning, Ryan. You want to go ahead and introduce yourself as well, Ryan Gillespie? And
can you hear me okay?
Yeah, go ahead, Ryan.
I'm Ryan. I'm with United Community Health Center. We are a nonprofit and we have 10 sites. We are mostly rural and we serve the underserved. We are primary care. I am the transportation manager. I'm also in charge of facilities right now and safety and compliance. So I am all over the place and trying to do my best to keep up.
Okay, well, thank you, Ryan. I appreciate you. Thank you for joining us today. I think I see Renee Stevens as well. Renee, you want to go ahead and introduce yourself, please?
Hi, yes, I'm Renee Stevens. I am the Chief Financial Officer here at the Tucson Jewish Community Center, and I work with our grant writer and program officer in administering the grant.
Okay, great. Thank you, Renee. I appreciate you. Luz, I think I see you as well from the city of Tucson.
Good morning, everyone. Hi, Luz Navarrete. I'm with SunTran, and I have been probably reaching out to a lot of you to talk about mobility training and different options that SunTran services can offer to you guys. So it's nice to see everybody again.
Great. Thank you, Luz. Appreciate you. Meg Knight, if you want to go ahead and introduce yourself as well. Thank you.
Sure. Good morning, everyone. I am Meg Knight. I'm the grant writer at the Jewish Community Center here in Tucson. I work closely with Renee, who introduced herself earlier, as well as Josh Shanker, who I think couldn't be with us this morning, but he's the director of programs at the JCC and largely involved in implementing this grant.
Okay, great. Thank you. Davida Mueller, I think I see you as well.
Good morning, Janine.
Good morning.
Hi, I'm Davida Mueller. I'm the Director of Service Planning and Development here at SunTran. I get involved with service planning on all modes, including the mobility management that we've been working on. And I also take care of grants and the Title VI coordinator for SunTran, SunLink, SunVan, and SunShuttle.
Great, thank you. Steve Nath from Hope.
Hi, I'm Steve Nath from Hope Inc. I'm the operations manager, and I basically juggle facilities and transportation for 7 sites across 5 regions. Most of the time, I'm just supporting Irma, who would be with us, but she had to be at a MAG meeting that they scheduled at the same time. So, yeah, we worked with general mental health, SMI, reentry. Gosh, just a ton of areas that were involved in outreach and opioid programs. And yeah, my biggest goal is just to keep paint on the walls and the wheels on the bus going round and round.
Okay, all right. Thank you, Steve. Jessica Winchester.
Hi, I'm Jessica Winchester, and I work for the Catholic Community Services, their Deaf and Residential Services program. I oversee the vocational and day services programs here. We work with individuals who have developmental disabilities, who are deaf or hard of hearing, and deaf blind. And we also have, Carmen is not able to come today, but Carmen oversees our client living program. And we have residential homes, group homes, independent living with them. And so her and I both relatively new here, a little over a year, but nice to see everybody again.
All right, thank you. And then Jenna from U of A.
Hi, can you hear me?
Yeah, hi Jenna, good morning.
All right. My name is Jenna Anzalini. I'm from the University of Arizona Parking and Transportation Services. I also have my lead here with me. Her name is Lorraine Padilla. We oversee our dispatch area, but most importantly for this meeting, our disability cart service program that offers door-to-door services for anyone on campus that might have disabilities here at the U of A.
All right, great, thank you. And then I think I see Nicholas Trees from La Frontera.
Hi, everybody. Nick Trees, La Frontera, Arizona. Under the La Frontera, Arizona brand, we have about 20 different entities that I support for transportation and facilities. That includes La Paloma Family Services, La Frontera Center, Inc., CBIS, Stone Corner Property Management, and the list goes on and on.
All right, well, thank you. And I think I see Taryn Lawrence. Good morning.
Good morning, Teron Lawrence from Intermountain Centers. I oversee fleet services for our organization, primarily serving children in residential programs and outpatient clinics.
All right, great. Good morning. And then John Hodbaker from Town of Oro Valley.
Hi, I'm John Hodbaker, and my co-worker, Mike Alexander, is also on this Zoom meeting.
All right.
And we run paratransit service for the Town of Oro Valley. Currently, our rider demand is higher than our ability to support that. So we have to curtail our trips every day because we don't have enough drivers. And so we're running probably about 220 trips a day because of the driver shortage. We could be running up to 260 a day easily or more. But that's about it. We run paratransit service for the residents of Oro Valley.
All right, thank you. Good morning, John. Good morning, Mike. Morning. Patricia Pablo, did you want to introduce yourself?
Yes. Good morning, everyone. My name is Patricia Pablo, and I am the grant writer supervisor for the Working with the Planning and Economic Development Department for the Donna Otham Nation. And this is actually the first time I also sit on the Transportation Planning Committee and the Management Committee for the PAG, Pima Association of Government. So
right.
This is the first time I'm a part of this new mobility, so it'll be a learning session for me today.
That's all right. We're glad to have you. So thank you for joining us this morning. I appreciate it. And then I apologize. Mike Alexander from Town of Aurora Valley. I kind of cut you off there. Did you want to introduce yourself?
Oh, yeah, I just said hello, but Mike Alexander, Town of Oro Valley. Hello.
All right. Great. Thank you, Mike. Sorry about that. I apologize. All right. Hopefully I captured everyone. I'm just kind of going back through real quick to see if there's anyone that I missed that might have joined while we're in the middle of doing the introductions. So if there's anyone else that's on the call that I have unintentionally missed in my attempt here to make sure everyone is able to introduce themselves, please go ahead and introduce yourself. Carmen Johnson, I think I see you.
I just joined. Hi.
Oh, great. Hi, Carmen.
Hi, I'm Carmen. I work at Catholic Community Services in the residential program, serving adults with developmental disabilities in group homes and independent apartment settings. And we cover the Tucson metro area.
Okay, great. Well, thank you for joining us. I appreciate that. We're going to go ahead and move forward with the next item on our agenda, which of course is in-kind reporting. And for those who might already be familiar with this, we do try to extend kind of a recap on the slide here about why we try to capture in-kind. But for the purposes of us collecting it in-kind, the one thing that's really important for everyone to remember is that if your salary or position is paid for with federal dollars, we just can't use your hours as they are presented here for this purpose of this meeting as in-kind donations. So if you have a salary or a position that's paid for with federal dollars, please make sure that I'm aware of that, just so that I don't count it for the in-kind reporting. So thank you for that. We're going to go ahead and move forward with the next item on the agenda, which is just trying to kind of give you a sense of the overall findings, if you will, or results from the survey that was done earlier in the year. And for those that might still be trying to get their results in, or would like to still participate, and I can circle back with those that are on the call day about that, we can make sure that those results get included. But we're going to go ahead and share a little bit about the results that we have thus far. So we're going to go ahead and do that. So just to kind of help give some context or rewind the tape a little bit about this particular survey for those who might be joining us for the first time, or it's been a year, right? So you might be like, when was that? What did we do? So just going to try to give some context. So many moons ago, so to speak, early in the year, we put out a survey for all of the people that are active participants in this mobility coordination group, or what we refer to as 5310 most commonly, but that doesn't mean that everyone that participates is being funded by $5310. We do have folks that are active and participate in these meetings, such as folks from the Pima Council on Aging with their Neighbors Care Alliance programs. Don't currently receive any funding through 5310, but they're still an integral part of what we try to do in terms of meeting the needs of the transportation needs of those that are elderly and or disabled in our region. So we extended a survey out to those folks and gave them an opportunity to kind of and give us some unique insights about all the great work that we're doing throughout the region and how we serve people in our region. So just to kind of give some context for things that we were trying to kind of unearth, is that we were trying to have a better understanding of not only where the agencies serve throughout our region, meaning like urbanized or rural areas, but if we were to drill down on the specific programs that each agency offers in our region that has a correlation with offering transportation services, where do those programs lie in terms of not only rural or urbanized areas, but also the demographic, if you will, that that program serves? And so when we say demographic, I use that loosely in the sense that we are trying to determine if the program has a primary focus regarding maybe perhaps seniors being ages 65 and over, or is it more focused on folks with a disability of a certain age being 18 or older as an adult, or is it children, and different variables such as those. So those were some of the things that we were looking at. And we were also, because the whole point of us coming together and working together is to advance coordination in our region. And that ties well into some of our other topics on the agenda today, which is with regard to the update to the coordinated plan. We wanted to kind of identify where is our greatest opportunity to coordinate transportation services to reach more people and serve more people throughout our region. So that was kind of the genesis story of that particular survey and why we sent it out. And today we're going to try to take a look at what some of those findings were, because some of the other pieces that we did look at was where is there opportunity to add value or to serve the agencies that are doing this great work with regard to fleet management, fleet life cycle, vehicle utilization, things of that nature, because without those integral pieces, it's hard to sustain the level of service that we're doing or even grow our services. So we're going to go ahead and take a look at some of the findings. So I'm just going to kind of give you some additional information with regard to the findings before we take perhaps like a closer look at a few specifics. So the first thing that I wanted to kind of give some context around is I think roughly we have about 13 agencies that are participating in the 5310 program, meaning that they have currently received or they have in the past received 5310 funding. And we do have FEMA Council on Aging, which has, I believe, 14 Neighbors Care Alliance programs that actually do provide transportation services throughout our region, but they also have I believe 3 other Neighbors Care Alliance programs that reach out to folks in our region with regard to maybe food delivery or meals or visitation. So perhaps they're not necessarily providing a transportation service, meaning they're not necessarily transporting an individual from point A to point B, but they are using a means of transportation to meet the needs of those individuals, whether it be a food delivery or a visitation to reduce isolation, especially during the time of COVID, et cetera. So with that, I just wanted to give some context for who we reached and kind of the whys behind it. When we got the information back, one of the great things that we unearthed was how many people are actually offering training to individuals on what options are available to them to make their way across the region in terms of transportation options. And out of those that responded, we had 92% of those respondents share with us that they do offer training on how people can best utilize the different options across our region. And then we had roughly 10% of folks in various stages, of course, of development training initiatives to kind of bridge that gap in terms of being able to actually say that they do that at this point. So that was really encouraging to know that that information is getting out there and people are being educated on the different options that are available to them. 46% of the folks that responded said that they actually do provide training on how to find public transportation or even private transportation and as the need might warrant. From a fleet management perspective, we have about 150 vehicles right now that are equipped with a lift to serve those that are in our region. And we have about 35 vehicles that are equipped with a ramp. So we have a pretty significant fleet that can meet the needs of folks with different types of disabilities. We have quite a few drivers that are actually PAS certified. So I know one of the things that we've been talking about over the course of the last year or so is how do we increase the number of drivers that are PAS certified and also increasing the amount of drivers that are not only PAS certified, but they actually have gone through the certification to to be a trainer, so that T3 type of training. So when we looked at the survey results for that component, we actually have 5 drivers that are certified to teach PAS training in our region. And so one of the things that we have been working on is, how do we put that together and what date would be best to serve the different organizations in terms of increasing the number of drivers that would be actually certified in PAS training. And right about the time that I think we were going to kind of roll out some training, that's when COVID was announced and everything shifted. So we're just now getting back to a place where we can kind of regroup and say, okay, what dates might make the most sense for us to launch something like that. So stay tuned on that. We're actually going to kind of try to roll out some dates now. So that'll be encouraging. And so something to look forward to on that. Some other highlights that we have, which do segue into some of the things that we're going to talk about later in terms of priorities in the region, is how we actually schedule trips for those that we serve. When I say we, meaning all the different agencies. So most of the agencies appear that what drives their appointments is obviously the client need, but the service area in which they serve is often determined by a state contract, a member need, or in some instances, to some degree, the location of their facility. So those were some different nuances that we had to acknowledge and take a closer look at. Some other things that we learned was that trip scheduling, if you will, is mainly done on the needs of the client, and in a lot of instances, very much on demand. But a lot of the agencies obviously are using either their own staff to kind of manually orchestrate these different trips. Very few actually have software that do it for them or on their behalf. So as we look to kind of move the needle towards advancing coordination, that might be one of the things that we need to take a closer look at, is what platforms or what types of technology is something worth taking a closer look at. Like, you want to try to partner in some way or collaborate transportation initiatives. So those are some of the high level, if you will, highlights from the survey. I'm going to try and capture briefly some other highlights that we took a closer look at. So when we looked at the 53 funded agencies and the Neighbors Care Alliance programs through PCOA, we did try to look at the percentages of the programs that have a primary focus on specific populations in the PAG region. And so those specific populations, if you will, fall into a variety of buckets. And one would be like those that are elderly, 65 and up, those that are ADA eligible, those that are under 18 but have a disability, those that are 65 and up and have a disability, and then adults with a disability. So those were the different categories, if you will, of populations that we looked at. And if we were to take a closer look at out of those that responded, out of all the agencies that we're looking at here, only 5 have programs with a primary focus, and that's kind of like our operative word here. Only 5 have a primary focus of serving those that are adults with a disability. We have 6 that have a primary focus of ADA eligible, and then only 1 with a focus of individuals under the age of 18 with a disability. So obviously this is a smaller sample size, right? We're not talking about all the agencies that exist in our region. We're talking about those that are part of this program. So just for additional context there. Some of the other things that we took a look at was the number of 53 funded agencies, and of course the Neighbors Care Alliance programs that are serving within specific geographic areas. And this is where we talk about like urban versus rural. And if we were, and also kind of blended in the sense that there are some agencies that serve both in rural and urbanized areas. So if we look at the number of agencies that serve in those 2 categories, if you will, it does paint one picture, but it's also important to know, and this is one of the purposes of the survey, is what does it look like based on program type, right? So we had different program types, and some of the program or service types were for job development or vocational training, employment, day programs, trips to medical or dental or pharmacy related appointments, behavioral health, any type of resource or support services, after school programs, summer camps, if you will, and public transportation, right, in general. So when we looked at that, again, this is just for the folks that are part of the working group, meaning 5310 funded agencies, excuse me, and the Neighbors Care Alliance programs. The majority of those that serve in job development and vocational training are serving in more urbanized areas. Same with employment, day programs, medical and pharmacy, and to some extent behavioral health. It's very close on behavioral health between urban and rural. Resources and support were heavy in the urbanized areas. Same with after school programs, summer camps, and public transportation. And that one's a little slippery because we're talking about a very small sample size, so I don't want it to mislead anyone in that. So, so we have some opportunities within taking a closer look at how we can serve people better throughout a region, but specifically perhaps in rural areas. And so when we take a closer look at the rural areas, we actually broke it down by jurisdiction, if you will, or unincorporated areas of our region. And if we were to take a look at the number of agencies that serve all of Pima County, I think we have 6 agencies that serve all of Pima County. And those are all 5310 funded agencies. And then if we were to look at those that just serve Marana, we have 3 that are currently serving in the Marana jurisdiction. So we don't have a whole lot of 5310 funded agencies serving in the Marana area. When we look at more rural areas or other rural areas like Green Valley, we only have 2. In Sarita, we only have 2. Ora Valley, we only have 2. And then even within South Tucson, which isn't exactly a rural area, it's only have 2. When we look at Vail, the same, we only have 2. So there is an opportunity that exists to figure out how can we serve more people in rural areas through coordination. So that might be something that we'll take a closer look at and talk through when we think about our priorities. Just for perspective as well, we even looked at areas like 3 Points, which is a very rural area. There are a couple agencies serving, or I'm sorry, 1 5310 agency serving out in 3 Points. So just wanted to kind of give some context on what we did when we looked at the survey. And the other part that we're going to talk about is the boundary maps. And we did the boundary maps. That's what allowed us to kind of blend not only the details that we got from the survey, but the data points that we got from the service area boundary maps to be able to kind of unearth some of these findings. One of the other things we did with the service area boundary maps was we kind of had a great dialogue in developing those with you around the service hours that your transportation services operate within, so that we can kind of take a closer look at how many agencies offer 24/7 type transportation services related to their programs, how many are in the kind of the 8 to 4 space, 8 a.m. to 4 p.m., how many agencies are serving perhaps before 8 a.m., and then how many are serving even after 4 p.m. So I'm going to go ahead and move a little bit through the service area boundary maps next in our agenda, so that we can make sure that we save time for discussion for the regional priorities, because that is our biggest item on the agenda in terms of what we need to accomplish today and how much time we have available for this particular meeting. So if we could go ahead and move to service area boundary maps, we're going to go ahead and do that. So I have a variety of maps that I could show, but in the interest of time, I'm not going to show all of them, but I do want to give you some context of what we did map out. So we did map out all of the 5310 funded agencies to include Sun Shuttle, Dial Ride Services, and Sun Van. We also mapped out all of the boundary maps for all of the Neighbors Care Alliance programs, which would be 14 that provide transportation, 3 that do meal delivery, and then a few more that do visitations, etc. And then we also mapped out veterans transportation services, meaning those through the DAV, and then also those through the VA. And then we also mapped out several non-emergency medical transportation providers, NEMT. I believe we did 6 of those. And then we also did 6, I believe, private transportation providers. So in the interest of time, we're not going to show all those maps. So, but I would like to kind of give you some perspective to some of the things that we just went through, but also for what we're going to talk about when we do our discussion about priorities. So if anyone does not want me to show their map, and again, I'm going to preface this with these are draft maps, tell me that you would rather that I not show your map before I actually share it with anyone. So I'm going to just go ahead and ask for permission. So I do have Easter Seals Blake Foundation's map for vocational. So with your permission, I'll put it up on the screen just to use it as an example of what the maps look like when they were all said and done. If you'd rather that I not show them, I won't. I'll just pick a different one to use. So if it's okay, I'll use that one. Is Donna still on the call? I don't know if she can hear me. All right, maybe not. Maybe she can't hear me. How about Kimberly Herzing? Are you still on the call?
Yes, I am. Go ahead, Jimmy.
Would you mind if I show Moran Healthcare's map?
Go ahead, please.
Okay, all right. So, all right. And then I'm just going to share my screen real quick. And then can everyone see that okay? Can everyone see this okay?
Looks
Yes.
good, Janine.
Okay. Pardon me? Okay, so this is an example of Marana Healthcare's boundary map. And just for some context, Marana Healthcare has a mileage limitation on how far they will go out from their main clinic to transport people to appointments. So that's why you're seeing a circle as a radius. Obviously, when people would need service, if they were to reference this map, and this is not necessarily out for the general public to use, but it's kind of hard to capture the actual boundary per se when it's done based on exact miles, meaning when you put it in GPS, right, as you would drive it. This is more of like how the crow flies, right? So when you draw the big circle, so it's not an exact representation, but it gives you at least kind of a general idea of the area in which they serve and how far out theoretically it goes. So this one's kind of a unique one to show because of, it shows it as a perfect circle, but that's just the reason why. It's because their service area only goes out so many miles from a very specific location. We're just going to show another example of what we did with the data to show how things kind of all pool together. So this one, everyone see this one okay? Can everyone see that one okay?
Yes.
Okay, perfect. Thank you. So this one is a representation of the Neighbors Care Alliance providers with, of course, Dial-A-Ride, Sun Shuttle, and Sun Van, right? So you're not seeing the 5310 funded agencies in terms of more of like the nonprofits, just because one, I wanted to keep it a little cleaner, because once you get that many agencies, if you will, represented on a map, it can get muddled pretty quickly. So this just kind of gives you a great understanding of the reach that the Neighbors Care Alliance programs have in our region and where they are serving in relationship to where our Sun Shuttle routes and our Dial-A-Ride services are operating. And they're kind of color coded, so you can kind of get a sense of breadth on some of these agencies or programs rather that are through PCOA. So that is one map that we did. So I'm going to kind of leave that one with you there for a moment. And then I'm going to show perhaps one more. I don't know if Shaylin is on the call today. She's from Project More, so I won't use her map without her permission. But I will just go ahead and show you one more. And if you can see this one, okay, we'll go with it. This is for veterans transportation. And hopefully everyone can see this one okay. So veterans transportation is depicted in this map, and you will see that it kind of falls into two buckets, if you will. So for perspective, this lighter tan color, if you will, cream color, that's indicative of transportation that's provided by the VA for disabled veterans. And in order to qualify for transportation through the VA, you have to have a service-connected disability rating of 30% or higher to be eligible. And so if you are one that falls into that eligibility status, the reach for the VA is quite significant. They'll pretty much go all over our region. However, if you are a disabled veteran and you have a service-connected disability that's less than 30% or don't qualify through another means because they have some other eligibility requirements, then you have to reach out to the Disabled American Veterans Program, the DAV. However, you'll see that their service area boundary is much smaller, and they too have a mileage restriction in terms of how far out they'll go from Southern Arizona VA Medical Center. And that's depicted in this kind of a peach color, if you will, this circle. And again, this is more of a depiction of how the crow flies versus how someone would drive it. So, they have to kind of navigate that in terms of whether or not someone lives within their own defined boundaries or not. But this at least gives you an example of that. And I think it's an important distinction to make when we start to understand how many people are veterans in our region, how many are disabled in our region, and how many actually don't qualify for support through the VA. And so right now, I think we're leaning into 19,000 disabled veterans who have a service-connected disability, but it isn't at the 30% mark, it's at 20% or lower. So there is a need for transportation services for disabled veterans in our region. And the DAV's service area boundary right now currently is much smaller than if someone is being provided transportation through the VA itself. So just a point of understanding and helping you understand what were some of the things that we tried to look at when we got the results back from the survey that we did, but also what we tried to unearth, so to speak, from doing these service area boundary maps. So I'm going to go ahead and stop sharing the maps and just go back to being me, I guess, right? So hopefully that's helpful. All right, so that gives you some context for what we did with the maps and also the service area boundaries. Like I said before, we did take a look at the service hours. And one of the things that we noticed was that predominantly all of the providers that were surveyed, and again, that's the 5310 agencies and the Neighbors Care Alliance programs, the vast majority served between 8 and 4, and perhaps to some extent after 4, and everyone kind of had their own nuance in terms of what the cutoff time. So for simplicity, I'm just saying extended hours after 4 p.m. We only had 2 agencies that have operating hours for transportation simply between 8 and 4 p.m. And then we had quite a few agencies, I think 5, if I'm not mistaken, that actually provided service before 8 a.m., between 8 a.m. and 4 p.m., and then of course after 4. So that's kind of their range. So not 24-hour, but definitely still before 8 a.m. and definitely after 4 p.m. And I believe we only had 1 or 2 agencies that out of those that actually provided their hours of service to us at this point. We have 2 that actually provide 24/7. So we're going to be just confirming some of those hours to make sure our data is correct. I know a lot of you received a myriad of emails from me asking for updates on a lot of different things. And one of the pieces was your service hours for transportation related to your different programs. And the purpose of that was to make sure that what we felt we understood from doing the service area boundary maps is correct, and also for our findings. But the other piece is for when we update our Pima Find a Ride website, this information, the goal is for it to be put into the Pima Find a Ride website with your permission, of course, to update it. And the goal is for the Pima Find a Ride website, say that 4 times fast, when it's updated, for us to be able to offer people a much more user-friendly experience, but also when they get their search results, have it much more refined for their needs. And the maps will allow us to some extent give kind of an origination and destination point, so that the degree of accuracy of what agencies would populate, saying that they might be able to serve them, would be most accurate. And especially if they were to ask within a certain window of time, what agencies might be able to serve an individual's needs, those program hours will allow that to also be far more accurate. Obviously, there would also be qualifiers in that with regard to whether or not it's the transportation provider is open to the public, or if you need to be a client or a member or any other important information like that, to include rider eligibility, which is one of the reasons why when you filled out your profiles for me, which was great, you did ask for clarification on rider eligibilities, because we just want to make sure that whatever we were to communicate potentially in the future, part of that is accurate. So thank you so much for your help in that, and hopefully that was helpful. We're going to go ahead and move to the big discussion of the day, which is the regional priorities discussion for the update to the coordinated plan. So I'm going to try to make this easy enough for everyone to understand, whether this is your first time ever navigating this or this is your 100th time navigating this. So let me just minimize a couple of my windows here so that I don't confuse myself in the process, because that would not be good, right? So let me just do that real quick. And I'm going to pull up a little file that I have that will allow me to navigate this a little bit more smoothly than I would without it. Okay. All right, so, okay, so for our regional priorities discussion, I'm just going to try to give you kind of an understanding of where we're going with this discussion and what things we're going to try and tackle first, second, and third, et cetera, right? So the first thing is we have to get some feedback from you in terms of what you think are the priorities for advancing coordination in our region, right? So when we say advancing coordination in our region, that has a very big net, right? It can mean a lot of different things. It can mean how do we partner with public transportation, whether that be just traditional fixed route service. How do we get more people connected to that? How do we partner or help in a paratransit capacity, right? How do we help people get connected, or how do we offset some of those rides? It can mean how can we grow volunteer driver programs across the region, especially in rural areas where there's a great need. How can we help people get further across our region? So perhaps by coordination, we could take someone so far and then they get connected with either public transit or paratransit or a volunteer driver organization to take them the rest of the way. There's lots of different opportunities from a coordination of transportation services, but there's also coordination of resources, et cetera. So it's a very big net when we say coordination. So I don't want anyone to be confused by that, because sometimes, you know, one person's definition of coordination can be different than someone else's. So we're using a very broad definition because it can mean a lot of different things. So we're trying to decide what are the priorities to advance coordination in our region. And when we look at those opportunities, they're going to kind of try to fall into a variety of buckets, if you will, just to kind of keep it simple. I'm not saying these have to be the buckets. I'm just saying that if we want to compartmentalize for simplicity, you could argue that these might be some of the buckets. So the first one would be perhaps, how do we maintain our existing transportation services, right? We don't want to lose any of the transportation services that we have. We want to keep them going because they're doing great work. So how do we maintain those existing transportation services? If we were to say there's a second bucket that we want to explore priorities around, we could say, well, what about new or expanded services to meet any identified gaps, right? Or perceived gaps, right? So that would be another bucket. Another one would be coordination of transportation resources. So remember earlier I was saying coordination can have a very broad definition or a very broad net. It can mean a lot of different things, and sometimes it can get confusing when we just say coordination. So I'm trying to kind of dissect it a little bit there. So this one, we're talking about coordination of transportation resources. And then if we're going to pick a last bucket, which also can have a very broad definition, it's mobility management, right? And for those that are very active in the 5310 program, you know that in the application itself, there are different types of projects that you can apply for. So there's different types of capital projects, like applying for a vehicle. There's some non-traditional capital projects, there's operating, and then of course there's mobility management type projects. So for those that are familiar with that part of the grant application for mobility management type projects, when I say mobility management, it does include some of those, but it can also include other things, perhaps on a slightly broader scale. So as a reminder, all of the things that we will talk about in these three categories, we want to be mindful that we're trying to serve people who are seniors or elderly, 65 and above. We are also focused on folks who have a disability, and we're also mindful of those that are low income, right? Very disadvantaged population. So those are kind of like the four categories, if you will, that we're going to try and determine our coordination priorities or our regional priorities within. From that, or with that, we're also going to be trying to decide funding priorities. And so when I say that, here's some context for people that might be new to applying for funding, have never applied for funding, or have applied for funding before. So as you might know, if you have applied for funding before, the project that you are seeking down has to tie directly into the coordinated plan, right? And they'll actually, to some extent, ask you where does it show up in the coordinated plan to show alignment, right? We're now also asking for us to be more clear about that, in the sense that we want to forecast projects in advance, right? So here's the projects that we believe people will be applying for funding for, and then when people actually apply for them, through that and decide which ones are staying in and which ones are not. But so the purpose of determining the funding priorities is to make sure that we would have that alignment, right? And then also that you, being the providers of this transportation, they're serving a wide range of people throughout the region in various areas, have a voice in saying what you believe is the priority and what should be the funding priority, right? So if we wanted to say that the funding, this is an example, if we wanted to say that the funding priorities should be stabilization of current services, we could say that should be priority 1. And then if we wanted to, we could say, well, then expansion would be priority 2. And then anything else arguably would be priority 3. That's not for me to decide per se, right? That's part of this discussion, but we need to be very mindful and thoughtful about it, because when it comes to evaluating projects in the future and ADOT's decisions on that, based on the rubric that they would use, and the panel, and all of the things that go into that decision-making process, as they look at how it aligns with the coordinated plan, they would in fact look at what is the priority as per the coordinated plan. And so we want to make sure that whatever we decide, everyone understands that that's what we'd be putting in the coordinated plan, and then projects would by proxy have to align with that in terms of priority, right? So I'm going to allow that to kind of be our first discussion item, is from a funding priority perspective, what do you feel are the priorities, so that we can put kind of a label on them, so to speak. And again, those labels that I used before are just for example purposes. I'm not trying to tell you that that's what they need to be or should be, just to kind of give you an example, so that as we talk through this, you have a frame of reference. So I'm going to open it up for discussion on what you feel like the priorities are, and then we can kind of drill down on them and decide what categories they would be. So if anyone has some thoughts or things they would like to just talk through, we can open up the floor for that.
Janine, this is Meg Knight from the JCC.
Yeah, hi.
Hi, I was just wondering how many folks who applied for this grant didn't receive it this past year?
Meaning all or in part?
If you could distinguish, that would be maybe helpful, but I'm thinking just in part.
In part, I would have to be fair, one, I'd have to go back and look, because I wouldn't want to misrepresent anything. Two, I have to stay really close to the agenda that's on or I have to stay very close to the items that are on this agenda for this meeting and not go too far out. Just
yeah, I guess the reason I'm asking is because when, you mentioned is the priority, maintaining our current level or expanding, it would just be helpful to know how many organizations out there in our community applied for funding to serve, these various populations and didn't receive it. And if there are a lot, that will help, I would think, inform what our priorities are.
Right. No, that's good. That's good feedback. So let me go back and take a look at that and see what I can figure out or calculate and share. And then I can send that out. And then, we can obviously, have a second meeting to kind of follow up on this discussion. We might not have enough time to figuring out everything today. So we might need a kind of a part two. So we can definitely do that. What's that?
That sounds great. Thank you.
Okay. All right. So yeah, I'll write that down. And so I don't forget. And also so I know to kind of circle back on that. I think that's a good question. So thank you. So and hopefully I didn't confuse anyone on that. It's just that we do have to have our priorities listed in the coordinated plan. And when ADOT looks at our coordinated plan and makes decision about funding, they do look for alignment. But there's lots of factors in play, right? There's the rubric that you're familiar with on the scoring. There's lots of different factors in play. So I'm not trying to suggest that one is the begin all end all, but we do have to be mindful that whatever we say is the priority does get evaluated when those kinds of decisions are made. So I would be remiss if I didn't say that, and then we made a decision about what we feel the priorities are. And if that were to influence a decision on a project leader, that people will feel like they were misled. And I don't want anybody to feel like that. So, so I'm saying it as, not necessarily a cautionary tale, but I think we just need to be mindful of that. So I'm gonna, again, open up the floor for what you feel are the priorities in our region so that we try to kind of decide what we feel are our priorities overall. Like where do we reach consensus at, if you will, on that?
Janine,
Yes.
This is Donna. In thinking about the priorities, the couple of the things that come to my mind is, and I know we've had it as a priority before, and we keep trying to improve on the coordination between the 5310 agencies, because if we can get better coordination, then of course that's going to help other people with receiving the transportation they need. Maybe they are not clear that they can go to another agency or whatever. So I think just getting that coordination between the 5310 agencies is really important. And then, and going along with that, also just ensuring that everyone in the region who needs transportation, whether they're someone with a disability, a veteran, whatever, does have access. And I think that getting that PIMA Find a Ride going is going to help a lot with that.
Okay. Yeah, thank you. I appreciate that. And that brings up something that I think I might have forgotten to say. So thank you. When we did the survey, one of the things that we did ask was, what's the propensity for an agency to allow a non-client rider, if you will, be a part of their trip, right? So, because to be fair, we have a lot of 5310 agencies that are not open to the general public, or their programs, should I say, are not necessarily open to the general public. We do have some programs that are in varying degrees open to the public. So I don't want to suggest that there aren't any. But the majority are client driven only, right? Or member only driven. So with that, we did ask, how many agencies had a propensity to be able to allow a non-client rider during their trip. And if so, which populations would they be able to serve, right? And so we had a lot of agencies that said that they could take a closer look, right, at being able to coordinate transportation with another agency for adults who have a physical disability, and then also veterans with a mental health disability, such as like PTSD, et cetera. And then, but that was probably like our top two, if you will. The next were in the space of anyone who's considered elderly by the FTA. 65 and above is the definition there. And then we had a lot of folks that were open to youth with a physical disability. And then we also had developmental disabilities as well. So based on that, it looks like we do have an opportunity to take a closer look at moving the needle further on coordination between 5310 agencies, because we have some voices out there that says, you know, we have some work to do, but we're at least willing to take that next step at taking a closer look at how might this happen. And this is the rider group who's currently a non-client that we might have an opportunity to coordinate with another agency around. So to your point, Donna, it looks like we do have some evidence to suggest that at least we know where to start with that. And we also know what agencies kind of raise their hand for different things potentially. So we know which ones to potentially match up, so we can further the conversation around that. So I'd just like to open up the floor in terms of what other people are thinking about advancing coordination between other 5310 agencies. And then once we've discussed that, I'd also like to talk about what are the thoughts about also coordinating with volunteer driver transportation programs. So we'll start with what Donna had shared about advancing coordination between 5310 funded agencies. And just to be fair, something can be a priority, but it might not mean that we're ready for it today. So it could fall into like it's a priority, but we want to put it as one of our like our mid or long-term goals, just based on how long it would take us for actually that to come to fruition. And then we might have other priorities and that are, I don't want to call them low-hanging fruit, but for simplicity, meaning like it's something that we could probably tackle today, right? We're ready to move forward with it. So just because something's is being asked of what is a priority, it doesn't necessarily mean that you're saying that it has to happen today. We'll take a closer look at that after we define the priorities and say which is kind of like a short or a mid or a long-term goal. But we still need to be honest about what are the priorities in our region, regardless of how long it might take for us to achieve that goal, whether it be 1 to 3 years, 3 to 5 or longer. It's still a priority, right? It's just that the road ahead to accomplishing it might be a little bit longer, but it's still a priority. So so for simplicity and for example purposes only, coordination of trips between 5310 agencies, we might say, and I want everybody to give their voice on this, we might say that it's a priority. However, for some agencies, the realization of that happening might be quick, right? They're ready to go. They only have to do a few things to really be able to move forward with it in the next year or two. But for others, they know it's going to be longer than that. And others might be just really honest with themselves and say, I don't know how we can make it work. Like it's something we just have to keep looking at. But right now, in this day, in this moment, I don't know how we would do it. So, and that's an honest answer, right? But it doesn't mean that it isn't a priority. It just means that for some people, it's further down the road. So I'm going to throw back out there. What are our thoughts about coordination between 5310 agencies being a priority in our region? And I know everyone has their mics off, so which is a good thing, right? Because that's what I asked for. But just remember that you need to unmute to be able to talk.
This is John in Oro Valley.
Yeah.
And we were thinking if we had a better idea of which other 5310 agencies work in our region, I mean in our area, service area, and maybe we could develop a closer relationship with them, and they might be able to do some of the rides. Some of our rides might qualify for some of their services, and then that would open up our ability to give rides to more other people. So like, I don't know if there's like an agency that does like primarily medical, and maybe we could get them to do some of the medical trips that we do that are very simple. We don't do complicated medical like stretchers or anything, but then maybe it would open up some more trips for us to give to other people. I don't know if that's possible. So.
I know that there is 6 agencies that, based on their service area boundary map, they serve all of Pima County or all of the region, right? But based on program, whether it's medical or not, we have to down on that. And I don't have that information right in front of me at the moment. But we do have 2 agencies that definitely serve in Oro Valley, to your point, and not necessarily all over Pima County like that. They don't. If we sorted all of the data, so to speak, and said which ones serve all of Pima County, it was 6, right? But if I did a search and said which ones only serve, so to speak, in Oro Valley, but not, or they serve in Oro Valley, but not necessarily all of Pima County, we have 2 agencies. So, and one of them is definitely in the medical space. And then the other one, I would have to go back and look at their programs. But I think there's an opportunity there, so I can connect different agencies together on that. To your point, John, and Mike as well. I don't want to name the name of the agencies because I don't want anybody to feel like I put them on the spot. So I'm just gonna keep that in my little hip pocket for right now. But what's that?
That sounds great.
Okay, all right. I'm gonna make a note of that, and then there can be that discussion as well. Right.
And then if they have drivers who are not gainfully employed and they want gainfully employed on extra days, send them our way.
Okay, all right. Thank you for that. Any thoughts on what's been discussed so far with regard to 5310 agencies coordinating together as being a priority in the region?
Janine, it's Donna again.
Okay.
Just thinking back about what John was saying, and the fact, one of the issues I think that maybe a lot of us have in common is what John said, lack of drivers. Before COVID, it wasn't that way, but since and like our drivers they also work in other areas. They're support staff. They do a lot of different things, and so having right at this time a lack of drivers, I think is kind of maybe a common thread. I'm not sure how other people feel, but yeah, staffing has definitely been an issue.
Okay. And see, those points are good because it helps us understand potential barriers, whether they're temporary or long-term, but also it helps us understand the road ahead to getting some of these things in place, and whether it's something for some agencies we might be able to do it quicker, and for other agencies it might just take a little bit longer. Okay, so I have it written down as one of the potential priorities in our region, just so that we can move the discussion along, and then we're going to circle back and really try to hone in on what we feel are the priorities. So I'm hopeful that this will help. If not, I'm just going to go ahead and ask for some forgiveness and some grace, and chalk it up as a lesson learned, not to note to self, it didn't help, right? If it doesn't. So let's start with the buckets that I characterized earlier. And again, we're open for discussion. I'm not saying these are the buckets, allowing it to be a tool for discussion purposes. So hypothetically, if we were to say that one of the priorities is under the bucket of maintain existing transportation services, right? Examples of that can be, maintaining transportation services that we have, right? So like our existing dial-a-ride and on-demand services, right? And if you're not aware of the great on-demand services that are relatively new in our region, you need to talk to Luz and Davita and Chris, get plugged in on that. Existing volunteer driver programs, we want to keep those things going, right? So anything that it would take to help ensure that those keep going, we could argue is a priority in our region, whether that be operating funds, vehicles, software, right, for different things, preventive maintenance funds, right? Because without those pieces, it becomes very challenging to serve more people. Granted, you can have vehicles and have drivers, a whole different set of problems, right? But in a perfect world, let's say drivers isn't a shortage or isn't an issue, those would arguably be the things that we'd be looking at, right? And obviously, everything that goes towards supporting transportation services within, nonprofits, et cetera. The other part within that would be just like I was saying before, about like maintaining in a state of good repair, which ties into like preventive maintenance and traditional maintenance. So within that, obviously, we're going to look at replacing vehicles that have exceeded their useful life, and that ADOT has their standards on that. Obviously, the funding for preventive maintenance and funding for operations and general maintenance, those would be under that umbrella. And then the other part would be as a strategy, if you will, to maintain or existing transportation services, would be looking at other options for funding, right? That's more of a strategy, but it's still under the veil of that priority about what does it take to maintain our existing transportation services. And one strategy could be looking for other funding sources, right? So what are our thoughts about any of those items, if you will, being a priority in our region? Does anyone have a strong thought or opinion about, I think preventative maintenance is a priority, or I think making sure that we have, vehicles to meet the needs of our members, our clients, or the general public is the priority. I'm just going to kind of open it up for that. And again, just as a reminder, we're serving seniors, individuals with the disability and low income. So it's going to open it up for discussion on that particular category, if you will. And that's not an all-inclusive list. Those are just examples of what might fall in that category, just to get talking. Mary, I'm going to put you on the spot a little bit and let you have kind of some time to say like what you think, because you have a unique perspective of, the volunteer drivers. And I'm not asking you to speak right now, although you're welcome to. But as we navigate this discussion and determine priorities, I think it's really helpful for those that are on the call today and even in future calls to really kind of be able to better understand or see that other side, so that we're kind of have a balanced view on that as well. So if there's anything you want to share that would be helpful for things that we've already discussed briefly, meaning like the coordination of 5310 agencies, because I know I also planted a seed about partnering with volunteer driver organizations, but also as we lean into maintaining existing transportation services, things that might fall under that umbrella, because the volunteer driver programs is something we want to maintain as well. Under this umbrella, it would fall in that category.
Yeah, I mean, I think that this, I think that bringing them into the fold of this, as you and I have discussed, will be really important. And some of their issues that they're struggling with their volunteers, not unlike finding paid workers to be drivers, it becomes a little bit difficult. Yeah, I mean, I look forward to having them participate in some of their in the discussions about the nuances related to that, and then how to collaborate and fill these gaps that they have, and also that the 5310s have. So
okay,
more discussion to be had around all of that with them, and to get them at the table here too.
Okay, so thank you for that. So here's a question. So I've heard little bits from like Town of Oro Valley saying, you know, some of the challenges that they're facing currently with drivers. And I think Donna Gillette, or maybe with someone else, I thought I heard or saw kind of some agreement, you know, body language or, you know, a verbal statement that perhaps that reach of it impacting other agencies with regard to driver shortages or just challenges is something we all can relate to include with volunteer driver organizations. So I'm just asking, is that something that, especially since we're not, you know, COVID's not behind us, right? We're still in the midst of it. Is that something that we need to put as a priority in terms of addressing driver shortages, et cetera? I'm asking, I'm not trying to imply that that needs to be it. It's asking, is that something that we need to add to the mix? Anyone has some thoughts? No one wants to talk first, I know. All right, well, we're just gonna leave that one alone for a little bit then, I guess. All right, so we will, so what do we think about priorities with regard to maintaining existing transportation services? What priorities do we see in that? Anyone have any strong thoughts, considerations under that? Anyone have anything to share on that? All right, I'm just going to move to the next one then, which is new or expanded services to meet identified gaps. So in this one, we're talking about any efforts to develop or expand transit or any other type of transportation solution. But this would be in areas where there's little or no transportation options based on identified gaps, right? So earlier we were talking about how in a lot of rural areas, we have some challenges, right? Getting people from where they live to perhaps medical appointments or grocery stores or whatnot. But we also have potentially gaps in that spirit because of driver shortages. So, you know, a gap is a gap, right? Regardless of what the reason is, but usually it's a geographic gap, if you will, or we have a population that isn't being served to the degree that we would like to see for whatever reason, right? We just don't have enough ADA equipped vehicles out there, you know? So if a person has a physical disability, we have challenges meeting their needs, even though there might still be a lot of different transportation options, but they're not necessarily ADA equipped vehicles. So sometimes it's not always simply a geographic element. So, so with that, we would look at things like expanding volunteer driver programs as a strategy. You could look at expanding on different types of shuttle programs and use that with like a little asterisk, because it doesn't necessarily have to mean Sun Shuttle, right? Like public transit, although it can. It could also mean developing a program that acts like a shuttle. However, you know, we have to be careful in terms of competing with private. There's some things that you have to be very careful of, but it is an example of a strategy. So, and then obviously the development of any type of like public-private partnerships, meaning like partnering with hospitals in our region, et cetera. And then it can be potentially even as simple as just expanding service hours or renegotiating or re-examining service area boundaries, right? To have a little bit more reach. And I know for some people that might not sound appealing when you have a driver shortage. Like, how are we going to expand our service area if we have a driver shortage? But it is something that we need to take a look at for, planning and for the future, for when, there is a day when we don't have driver shortages. What have we worked on to bridge these gaps? And what was the methodology or the strategy that we used to address them? So for new or expanded services to meet gaps, just as a reminder, we have that could be volunteer driver programs. It can be new or expanded on-demand type programs. And on-demand can be your own on-demand programs, meaning those of you that are in social service organizations, but it also can be new ones that we identify that perhaps partner with Suntran on. It can mean a variety of different things. So it also can mean partnering potentially with non-emergency medical transportation providers. A lot of those agencies have pretty significant reach. Obviously, they have ADA accessible vehicles. But I mean, those are conversations to be had. The other part would be like last mile type services, right? So people are just kind of on the outer edge of having great access to public transportation, whether it be paratransit or otherwise. But just given where they live, they're just slightly outside of that. So how do we work together to build that bridge, saying like, how do we can get people better access to public transportation? So instead of taking them the entire way to wherever their destination is, we can't necessarily do that logistically. And the goal is to coordinate with public transit. In this particular example, we would just take them to the nearest appropriate, bus stop or what have you. Those are other ways to expand service. So those are just examples. There's plenty of others, but just to get the conversation started, what do we see as some priorities or thoughts around new and expanded services in our region?
Janine, just to
oh, sorry, Nick, I just now saw your hand up. I apologize.
It's okay. I just put it up. But for me, I don't have a lot of answers to these questions because like someone said previously, I'm kind of focused on keeping the paint on the walls and the wheels on the bus turning.
Yeah.
I really like that. But, we do have access to thousands of our members that could help provide this information if needed.
Mm-hmm.
And if at any point that you wanted to create a survey to kind of gather information from those who are utilizing or trying to utilize the services to see where they feel the gaps might be or the improvements that might be needed, I'd be more than willing to help set that up.
Okay.
That
would be great.
As simple as something as a survey they can fill out in one of our client lobbies, or something that we can ask case managers to provide information on what do they feel the transportation of their needs of their clients are, and what gaps need to be filled. I'm pretty far removed from the clinical side these days, but I think that would be the best place for us to gather this information.
Okay, that'd be great. I might talk to you about that offline and see what makes sense and the timing of it. I know, with other planning processes, reach out to the general public in a variety of ways to kind of unearth lots of information that might be very similar to what you're talking about here. So I don't want us really want to duplicate efforts, but I don't want to also opportunity to identify, needs or see where we can make a difference in the region. So we could definitely talk about that offline.
Okay. Yeah,
So thank you.
I just wanted to break the silence here. And
yeah, no, it's good. I appreciate that. I know it's difficult or can be difficult in this kind of a setting because you can't see everyone's body language and, oh, is that person getting ready to talk? I don't know. So I know it's a unique time doing these meetings virtually, and this is a big topic, so it could be a little overwhelming, but we will get through it, right? So, okay, so let's talk about the last two, and then we'll circle back, and we kind of have to make some kind of a decision about what we think are our top priorities, even if we're not being super granular about it. We're just giving it big headings, and then we can focus on specific strategies, if you will, later. But you kind of have to have some intentionality about what we think are the big pieces, if you will. So the next one is coordination of transportation resources. And this is basically, I mean, if you want to keep it really simple, right, it's interagency coordination efforts that would exist or develop towards, it could be a variety of things. It could be like helping each other with like ride scheduling or dispatching systems. It could be sharing of vehicles, or even share costs on like vehicle maintenance, right? Different vehicle maintenance types initiatives. It can be sharing of driver training programs. There's a really great example, I think, because we talked about PASS. Most of you know the great work that Hope has done on their driver assessment tool that they developed, that they evaluate their drivers with. Town of Oro Valley's, like, we're known for their program for accident prevention and other driver training methodologies that they have. I know Beacon Group, as well as many others, have a really great like best practice with regard to like preventive maintenance. So that exchange, or that standardization, if you will, of everyone following a very similar model, so that we know like our standard of care, if you will, is the same. Those are all examples of coordinating transportation resources that allow us, hopefully, right, to save costs, but also to further our efforts, not just in coordinating resources, but being able to be confident in coordinating trips, because if people have a greater sense of confidence that vehicles are maintained to the same standard as their own vehicles, it plays better in that space of saying, okay, how do we take that next step? There's other things like joint procurement and stuff that can be much broader in scope, but they are examples of interagency coordination with regard to coordination of transportation resources. Obviously, like referrals, right? If you can't provide the service transportation-wise, you could refer to somebody else. Obviously, those are lots of conversations to make that happen potentially, but it is an example. Someone had mentioned the Pima Find a Ride website other than myself. And so, you know, in a day, if we have the right data, that could serve to some extent as almost like a referral database, because by proxy of someone using it, they would know which agencies could help them if, for whatever reason, the one that they initially started with isn't necessarily the best fit. They at least have a starting point, or people within your own staff to unearth who might be better served to help them in some capacity. That database could be a potential resource. It's just hypothetical at this point. Like, we would have to have a lot of talks and discussions and make sure it makes sense, and you know, is it sustainable and all that stuff. But it's an example of something that would fall into that space. The big one is improved coordination with public paratransit. Like that, if we can be mindful of one that's kind of like the obvious, right? Like that we really should be looking at. Some of the other ones might still be worth looking at, but they might be more future stated. Than when I say some, I'm talking about like joint procurement and stuff like that. But some of the ones that are more obvious and we probably should take a closer look at, and this is up for discussion is coordinating with public transit. And if we can move the needle on that, that would fall into this particular category. And it can kind of also blend into something else, right? Which is the one about expanding services potentially. So they don't necessarily just sit in one category. The last one is mobility management. And I don't want to call it the catch-all, like everything else just falls underneath that. I don't mean it to sound like that, but just for simplicity, some of the mobility management strategies fall into a lot of the things that we were talking about earlier, but don't necessarily fall into those previous categories. So some of those examples are, how do we make sure that people are aware of transportation resources that are available to them? If they themselves, a loved one, et cetera, has need for transportation and they're elderly, they're disabled, low income, how can we better serve them? Suntran's doing great work on, advancing their travel training program. They have a lot of great ideas on what they'd like to see happen with it in the future. So it's a great time for us as a group to really partner with them and work with them on how do we get kind of the word out? How do we make sure that we're meeting the needs of those folks with regard to travel training? So be mindful of that. The other part is we were talking about like on-demand services. So Suntran has some new on-demand services in, I believe, in 2 different zones. But some of you kind of have your own on-demand methodology. So where's kind of the nice intersection with those? Is there an overlap? Do they partner well together? What does that look like? Those are conversations that we could easily have with Suntran to say, like, how can we work together on this to advance some of these on-demand options? The standardization of driver training programs would also fall in this category. And I already kind of said some stuff that we've been working on, and some stuff kind of take a back seat for a little bit because of COVID, but we're ready to bring it back into full swing. Any efforts that we can do on driver assessment tools, accident prevention, passenger assistance, safety and sensitivity, any kind of advocacy elements that we can bundle into that, all those pieces fall under kind of that mobility management category. And we can be mindful of that. The other part is that referral service, right? Which is tying back to, potentially a database, but referral services, any kind of methodology that we could use to be a great referral service to people that need services in this space would be great. And that's not an all-inclusive list, right? And then in this survey, you probably remember we talked about like metrics and tools that would help us for vehicle utilization, fleet forecasting, stuff like that. That still falls under this category. And the fruits of those efforts obviously still help us to maintain our existing fleet. So you'll see some overlap there. So I've said a lot. Kind of have 4 categories and layers of each. I really need to hear from you what's really jumping out at you as saying, like, I really think that our focus should be here, and that doesn't mean it's going to be, priority 1, we're going to nail this in the next 12 months. It just means this should be our primary focus, and whether it's going to take us 3 years, 5 years, or longer, that's up for discussion. But at least we know what we feel is our priority for the region. So any thoughts on what you experience, what you're seeing, all the discussions that we've had over the last year, some of the highlights from our findings? And obviously I'm going to send you folks your individual maps so that you could take a look at them closely and see if they need some tweaking or some adjustments, but what are our thoughts so far? And I don't know if Pamela is still on the call. Pamela, are you still on the call? Let's see if she's still on the call or not. She might not be. It's going to circle back with her. So anyway, so I'm just going to kind of throw it out there for what you guys think, what your thoughts are.
Janine, Donna again.
No, you're fine.
I mean, I really think we did cover a lot, and I think that some of those things we covered really do need to be priorities, like the stabilizing of our current services, and then also the coordination. Would be possible if you could put those few items that we discussed, on a little like survey with a space for comments, and maybe send it out to everyone, and then if people don't want to speak up on it, at least that way you would have
Sure.
your thoughts on those things.
Yeah. So I could do that. So I can take a heart of what we've talked about today in terms of like in these different categories, and then kind of put it in a survey monkey of sorts, and send it out. And then if for whatever reason the particular survey type that I select doesn't allow for sufficient notes, just put it in your email, and I'll kind of attach the two together, so to speak. And that would be helpful. I just really want everybody to have like a voice on this, and also kind of understand the scope of the things that we're considering when we say trying to decide what our regional priorities are. But I also want you to understand, where we've been. Like, we did the survey, we did service area boundary maps, we matched the two together. We have data from other plans that have been developed, like our RMAP. Centran does, their own like marketing, their own strategic plan. Like, all of these efforts kind of come together to help understand what the needs are in our region. But the agencies that are part of 5310, they're serving a very specific population, and you kind of have a unique perspective, and you have unique insights with regard to how to best serve different people in our region. So it's important that we get your voice on that. It's also obviously important as we want to make sure that whatever we reference as the priorities are have been well thought out, so that when agencies apply for funding, their projects can be in alignment with those priorities. So I will send out the survey. Anyone else think that would be helpful? Anything anybody else would like to see as a tool to help us have an easier time navigating this? I know it's a lot. It's a lot to take in, and there's a lot of us on the call. So anybody has any other thoughts or considerations? I'm open to that. All right, I'm going to go ahead and wrap this meeting up, and just allow for people to have any final comments or thoughts as we move to not only just sending out that survey, but making some decisions around what we feel are the priorities. I would like to schedule another meeting, kind of like a part 2, if you will, for the regional priorities after we get those survey results back, so that we can kind of take a look at what we've learned through that process and kind of figure out where we want to land on this. Sound good? And I promise you the next one won't be this long, the meeting. Promise you won't. But we had a lot to cover today, so it's kind of had to be, I guess. Thoughts, considerations before I adjourn the meeting? Anybody? All right, well, I am going to go ahead and adjourn the meeting. Thank you so much, everyone, for investing a significant amount of your morning into this meeting. I appreciate it deeply, and I thank you for all the hard work that you do every day serving people throughout our region, but all the work that you've put into helping us to develop the updates to this coordinated plan. And I look forward to seeing your insights through the surveys so that we can include them in the update. So I will send out an invite for the follow-up meeting, given that there's holidays and whatnot in November too. So I'll try to figure out a good date for that. But the turnaround time, I would like for it to be quick just so that it stays fresh in our minds. Let too much time go by, we're all busy. It's easy to forget, and then we have to go back, and I don't want to have to do that. So if that's okay with you, it might have a tight turnaround time. So just be mindful of that. All right. All right. Thank you so much, everybody. Have a great day. I appreciate you.
Thank you, Janine, for all your
bye.
work.
You're
Bye.
welcome. All right. Take care. Bye-bye.